So knee pain and knee problems, in medical terms, that's what we call patellofemoral pain syndrome. And basically what that means is that the kneecap is rubbing on your femur, the bone in your upper leg, it's rubbing on it in an abnormal fashion. So when you're walking, when you're moving your leg in any fashion, bending and straightening your knee, or even just when you're sitting with your knee bent, what should happen is that your kneecap should stay in this tunnel that's in your femur. Now when you're walking and your knee is bending and straightening, that kneecap, that bone should track straight up and down in that tunnel. And if that happens, then your knee is not going to be painful. Everything's working the way that it should work, and you're not going to have any problems. But in patellofemoral pain syndrome, or in knee pain as you would call it, what's happening is instead of that kneecap tracking straight up and down, something's causing it to track side to side at the same time it's going up and down. So a patellofemoral pain problem, or a knee problem, isn't just a problem in your knee. It's the result of some weakness and some issues in your hip, some mechanical and positional changes in your knee, and some weakness and mechanical issues in your foot and in your lower leg. The muscles in your hip, usually in the outside of your hip and in your gluteal muscles called your piriformis, your obturators, your gluteus medius and your gluteus minimus predominantly, all of those muscles attached to your IT band that runs down the outside of your leg. Well, that IT band runs down the outside of your leg and it attaches to the outside of the knee. If those muscles are weak, then what's going to happen is your knee is going to start to cave in. It's not going to be a big cave in that you see. When your heel hits the ground and you begin to shift your weight over the top of your leg when you're walking, your knee is actually caving in because those muscles on the outside of your hip aren't keeping it pulled out. So when your knee starts to cave in, your kneecap starts to change its position. And so instead of it tracking straight up and down, as the knee caves in, the kneecap gets pulled in that outward direction, and now it starts rubbing side to side, and that's what really starts to cause the pain. The back of your kneecap is actually a soft bone. There's a lot of cartilage on the back of it. And so if you've ever experienced cricking or cracking or popping or grinding or stiffness or anything like that in your knee, that is patellofemoral pain syndrome. Traditionally, we'll see somebody that's having knee problems or patellofemoral pain problems, they'll be uncomfortable when they're walking for a long period of time. They'll be uncomfortable if they're sitting for any period of time, because again, sitting in that bent knee position, that kneecap's getting pushed back against the femur. They'll be uncomfortable going downstairs. And as the problem progresses and gets worse, then you'll start to have discomfort even just in lying in bed, even when you're standing, walking for any short period of time, and going up and down stairs. Squatting starts to become uncomfortable as well. And again, it's any time that knee is bending, the kneecap should be tracking straight up and down, but if it's tracking side to side, that's really when the problem gets into play. So what can we do to prevent that? Well, the biggest thing that needs to happen is somebody needs to evaluate your entire leg, and that's really where an expert physical therapist at Loudoun Sports Therapy Center comes into play. Somebody needs to evaluate what's happening at your hip and your pelvis, what's happening at these muscles, what muscles are tight, what muscles are weak, what happens at your knee when you walk, does it cave in? Somebody needs to be able to look at what your kneecap is doing when you bend and straighten your knee. Somebody needs to look at your calf and your lower leg, what your foot does when your foot hits the ground, and put all of those things together, because that's what's really going to fix this knee pain or this patellofemoral pain. Simply doing some stretching, not going to fix it. Simply doing some strengthening, not going to fix it. Simply combining both of those and doing strengthening and stretching, not going to fix it if we don't stop that kneecap from moving side to side. And that's really where an expert physical therapist at Loudoun Sports Therapy Center comes into play. So if you're having any knee problems, understand stiffness, soreness, tightness, or if it's gotten to a point where going up and down stairs, walking, squatting are painful and uncomfortable, or even just sitting through a movie, you've got patellofemoral pain syndrome. Why not get it taken care of now? Prevent it from turning into some arthritis or some bigger problems. Let us do a full evaluation on you, figure out what's going on, and get you set up for a good treatment plan to get the problem taken care of.